Now Paneer Selvam is also in the picture. The great controversy about metformin and insulin between 12 weeks to 20 weeks. The final opinion from you before I play the concluding video by sir. Paneer, thank you for joining. You seem to be traveling somewhere, but still you have bothered to join. Thank you so much.
I'm coming from another meeting, madam.
Yeah, no
Thank
problem.
you for organizing this, madam. Of course, metformin we have discussed many times, madam, but in our clinical practice, we continue metformin for some of the PCOS or some of the IGT before conceiving. So far in our clinical practice, we don't come across any adverse effect, madam.
Right.
But the controversy continues, but practically or clinically, we don't come across any adverse effect on the fetus or after the childbirth also. But mother is also protected, madam. In future, the GDM development or the frank clinical diabetes development is much rare or we can avoid. So metformin can be continued even before 3 weeks also, madam. In our clinical practice.
Actually, Government of India has now approved metformin even during early pregnancy. There are references.
Yeah,
yes,
there are references. 12 to 20 weeks, seems to be like one.
No, that is in the guideline. That is in the national guideline.
Universally, they have accepted.
Yes.
Nice guidelines says it can be used during early pregnancy, and Government of India has approved that for the early pregnancy.
Yes, 2018 they have said early pregnancy till 12 weeks, yes. But after 20 weeks also, yes. But 12 to 20 weeks, purposely people are bringing in that controversy in order to confuse everybody, even for the use of before and after. That is what is happening.
Correct.
But now the European guidelines have approved of metformin like continuum everywhere. I feel that we as obstetrician will tap some of the centers, especially the infertility and high-risk pregnancy centers, where they're not aware of the stoppage between 12 to 20 weeks. They're inadvertently, for all PCOS patients, to be on safer side, they're continuing metformin and without any problem or complication. If we get this group to give us that data, then we will be on a stronger edge to say that this is yet another new series from the Indian context, where beyond 12 weeks also till 20 weeks we have continued, and some of the gynecologist and pediatrician couple, they have an access to the follow-up of the babies also. So if that also we can put a act together and produce that data, I think once for all, this problem also will be a little bit eased out and resolved, because in the Indian context, any day, the oral therapy scores far beyond the injectable and the monitoring that and the hassles that it carries with that.
Hema, one more thing. In Tamil Nadu, thanks to the Dr. Muthulakshmi Reddy scheme, so they are giving nearly 20,000 rupees in different installments. First, second, third installment, then after postnatally, after 3 months, after they complete the immunization for the child, the last installment is being given. So if they are indexed as GDM people and the baby of GDM mother, then it is very easy to follow up, because before giving the final installment of money, they'll make sure that this follow-up is being done. Excellent. So we have to just link it with, as we have linked with the contraception, linked with this GDM also.